So Will, let us know when it's ready.
You are live.
All right. Good afternoon, everyone, or good morning, wherever you are. And I'd like to welcome everyone and thank each of you for participating in this meeting. This is a public meeting, and my name is Ala Kamel, and I will serve as the designated federal official, or DFO, for the Science Advisory Committee on Chemicals, which is also known as SACC, the peer review of draft proposed principles of cumulative risk assessment under the Toxic Substances Control Act, and a draft proposed approach for the cumulative risk assessment of high priority phthalates and a manufacturer requested phthalates. And I would like to welcome everyone for today's preparatory virtual meeting. As the DFO for this meeting, I serve as a liaison between the peer reviewers and the agency. Also in my role as DFO, a critical responsibility is to work with appropriate agency officials to ensure that all appropriate ethics regulations are satisfied. In that capacity, reviewers are briefed on the provisions of the federal conflict of interest laws, and each peer reviewer has filed a government confidential financial disclosure report, which has been reviewed and to ensure all ethics requirements are met. This is a preparatory meeting focused only on the scope and clarity of the charge questions. The meeting is for the peer reviewers and for the public's benefits. So far, we have 6 public commenters who registered to make brief comments related to the clarity and scope of the charge questions. The agency appreciates peer reviewers' times, diligent work in preparing for this meeting, and the public for attending and sending their comments. A meeting roster of the SACC members and peer reviewers is posted in the docket, among other meeting documents, at regulations.gov, and the docket number is EPA-HQ-OPPT-2022-0918. Please be advised that the agenda times are approximate, and when the discussions for one topic is completed, the discussions for the next topic will begin. I also wish to thank my EPA colleagues for all their efforts in preparing for this meeting. Joining me in this sessions are Steve Knott. Steve is the Peer Review and Ethics Branch Chief at the Office of Program Support of the Office of Chemical Safety and Pollution Prevention in EPA. Also, Tanu Gibson, she's the Executive Secretary of the FIFRA Scientific Advisory Panel and for the SACC. We have Dr. Charlene Matten and William Moogie. They are also DFOs, and they are also both the Assistant Deputy Ethics Officials. We have also Joyce Coates and Barbara Ewell, and the EPA contractor in DINA, and they will all provide administrative support for us. We also have the team from the Office of Pollution Prevention and Toxics, and they will be introduced when their presentation comes. Now, the SACC chair, Dr. Daniel Schlenk, will lead us in a few minutes to the introduction of the SACC members and the peer reviewers, but I will start talking about the logistics of this meeting, and then Dr. Schlenk will follow me. So regarding this meeting operations, we will ensure the adequate time for the agency presentations, public comments, and peer reviewers to discuss their questions with the agency presenters and public commenters. This meeting is being webcast over the internet, via YouTube, and by teleconference for audio. Speakers are asked to state their names and affiliations, and the meeting is being recorded. And a link to the YouTube video is available on the meeting website. There is a public docket for this meeting, and copies for all materials and public comments will be available at regulations.gov under the docket number I mentioned earlier, and it's also listed in the Federal Register notice. We posted a draft agenda for the meeting and regulations.gov under the same docket number. In addition, links to the meeting information and supporting documents for this meeting are also available on the SACC website, www.epa.gov/TSCA-peer-review. Keep in mind that this meeting is only for points of clarification regarding the charge questions, not for reviewer or public discussions or technical information or response to the charge questions. For members of the public who previously requested time to make a public comment, your remarks need to be limited to 5 minutes, please. For others on the phone listening in or watching the YouTube video, at the appropriate point noted on the agenda, if you are a public commenter, I will call for the you would be called for public comment and the operator will open the phone line or speaker for you. Again, I wish to thank all the reviewers for your participation in today's meeting, and I will turn it over to our esteemed chair, Dr. Daniel Schlang.
Thanks, Alec. Good morning and good afternoon to everyone. At this point in the agenda, it's our opportunity to introduce ourselves to the public and to the EPA before we get into the questions regarding clarification for the charge questions that we will be addressing later on. So at this point, I would just remind the committee to please state your name and your affiliation, as we have a limited time frame and we have 29 members on this particular committee. So I will begin. My name is Daniel Schlenk. I am at the University of California at Riverside. And at this point, we'll go alphabetically through our SACC committee, and we'll begin with Dr. Apte.
Hello, everybody. My name is Udayan Apte. I'm at the University of Kansas Medical Center in the Department of Pharmacology, Toxicology, and Therapeutics.
Thank you. Dr. Baker? Okay. Dr. Blystone?
I'm here. I'm sorry.
Okay. Go ahead. Go ahead, Dr. Baker. I think you're on mute. Not hearing. Okay. Let's go ahead and move to Dr. Blystone. Okay. No one there. How about Dr. Chason?
Christine Chason with the Lifeline Group.
Thank you. Dr. Cobb?
George Cobb, Baylor University Department of Environmental Science.
Dr. Davies? No. Dr. Heiger-Bernays? Dr. Johnson? Dr. Kissel?
John Kissel, Professor Emeritus, Environmental and Occupational Health Sciences, University of Washington.
Dr. Maserlian? No. Dr. Prisbilla?
Jennifer Prisbilla, ATSDR.
Dr. Reif?
David Reif, NIEHS.
Dr. Rollins?
Greg Rollins, UL Solutions.
Dr. Voorhees?
Chip Voorhees, University of Cincinnati and Cincinnati Children's Hospital.
And now for our SACC ad hoc peer reviewers, Dr. Babich and Dr. Braun.
Joe Braun, Associate Professor in the Department of Epidemiology at Brown University School of Public Health.
Thank you. Dr. Califat.
Antonia Califat, Centers for Disease Control and Prevention.
Dr. Chapin.
Bob Chapin, now retired from Pfizer and NIEHS.
Dr. David.
I'm Ray David. I'm a retired toxicologist.
Dr. Engel.
Stephanie Engel, University of North Carolina at Chapel Hill.
Dr. Fox.
Mary Fox, Johns Hopkins Bloomberg School of Public Health.
Dr. Hertzberg,
Yes, Richard Hertzberg, by Mathematics Consulting, retired from US EPA.
Dr. Hadashell,
Kimber Hadashell, NIEHS Division of Translational Toxicology.
Dr. Kwok,
Eric Kwok with the California Department of Pesticide Regulations.
Dr. Payne Sturgis. Okay. And Dr. Tan,
Shirley Tan with Seattle King County Public Health Department.
Dr. Wyckoff, who joined us? No. Dr. Zoda.
Ami Zoda, Columbia University Mailman School of Public Health.
All right, thank you very much. At this point, we'll move into the presentations, or a presentation, I should say, by the agency. This will be made by Anthony Lutz and Maiko Arashio. Again, just a reminder that the comments here that you have should be questions regarding the charge questions that we have to provide clarification there. Do not provide any sort of technical comments at this point. Also, please use your hand raise function so that I can address you in order as I see them coming off. I would also state, please state your name prior to asking your question as well, so that that gets put on the written record. So with that, let's begin the presentation.
Good afternoon, everyone. My name is Anthony Luz, and I'm a human health assessor in OPPT's Existing Chemicals Risk Assessment Division. First off, I'd like to thank all of the members of the SACC and anybody from the public for taking the time to attend this preparatory meeting to go over the scope and clarity of the charge to the SACC ahead of the meeting on May 8th through 11th. Today, you're primarily going to be hearing from myself and Maiko Arashiro, who's a exposure assessor in the Existing Chemicals Risk Assessment Division. However, I'd also like to take a quick second to acknowledge that a number of additional staff in OPPT's Existing Chemicals Risk Assessment Division, as well as several senior science advisors in OPPT and OCSPP, and several subject matter experts in EPA's Office of Research and Development, really significantly contributed to the development of, OPPT's draft proposed principles of cumulative risk assessments under the Toxic Substance Control Act, and our draft proposed approach for cumulative risk assessment of the high priority phthalates and the manufacturer requested phthalate under TSCA. Next slide, please. Okay, so I'd just like to start off with briefly going over some of the high-level requirements under TSCA as they relate to cumulative risk assessment and risk evaluation more generally. The first one is a big one. TSCA Section 6B requires EPA to conduct risk evaluations to determine whether a chemical substance presents an unreasonable risk of injury to the health or the environment without consideration of costs or other non-risk factors, including unreasonable risk to potentially exposed or susceptible subpopulations or pests identified by EPA as relevant to the risk evaluation under the conditions of use. As far as conducting a cumulative risk assessment under TSCA goes, the statute does not explicitly require EPA to conduct cumulative risk assessments. However, nothing in the statute prohibits EPA from conducting cumulative risk assessments either. But what TSCA does require of EPA when conducting TSCA risk evaluations within our statutory timeline of 3 to 3.5 years, it requires us to consider the reasonably available information consistent with the best available science and make decisions based on the weight of scientific evidence. And I think this is a really important point, and we ask that SACC take these points into consideration, as they develop responses to our charge questions moving forward. So that is, we have statutory timelines conducting risk evaluations of 3 to 3.5 years. And we'd also ask that SACC consider, what reasonably available information is, which is information that EPA either possesses or can reasonably obtain or generate and synthesize for use in a risk evaluation within that 3 to 3.5 year timeline. Another thing to point out off the slide is that, although TSCA doesn't explicitly require EPA to conduct cumulative risk assessments, EPA does recognize that for some chemical substances, the best available science may indicate that the development of a cumulative risk assessment is necessary and appropriate to ensure that any risks to human health are adequately characterized. Next slide, please. Now I'd like to just talk briefly on the scope of EPA's draft proposed principles of cumulative risk assessment under TSCA documents. So this document is just that. It's proposed principles documents that outlines the principles of cumulative risk assessment as potentially conducted in support of the TSCA. It really relies heavily and builds heavily off of previously published and well-vetted works by EPA's Risk Assessment Forum. So this includes the older agency guidance on mixtures risk assessments, and the supplementary guidance on mixtures risk assessment, as well as the RAF's 2003 cumulative risk assessment framework. It also builds off of more recent guidance documents from the Office of Pesticide Programs, the OECD, the World Health Organization, and the International Program for Chemical Safety, as well as the European Commission. Within our proposed principles document, we rely on the definition of cumulative risk assessment from the Risk Assessment Forum's 2003 cumulative risk assessment framework, which defines cumulative risk assessments as an analysis, characterization, and possible quantification of the combined risks to health and or the environment from multiple agents and or stressors. So under this definition, stressors may refer to chemical or non-chemical stressors. For purposes of our proposed principles document, we're really focusing on chemical stressors. We're also focusing on cumulative risk to human health from exposure to toxicologically similar chemical substances. At this time, we're not focused on cumulative risk to ecological taxa. It's also important to acknowledge a little bit further here what our proposed principles document is not and what it does not do. First, the principles document, it's not a framework or detailed guidance document on the detailed process for conducting a cumulative risk assessment. It also does not address cumulative impacts, which refers to the total burden, positive, neutral, or negative from chemicals or chemical stressors or non-chemical stressors and their interactions that affect the health, well-being, and quality of life of individuals, communities, or populations at a given point in time or over a period of time. OPPT recognizes that this is a really active area of research in EPA's Office of Research and Development. So they're actively looking into methodologies for conducting cumulative impacts assessments and quantitatively accounting for non-chemical stressors in the context of a cumulative risk assessment. And really at this stage, OPPT doesn't want to get out ahead of ORD. So at this time, we are not intending on quantitatively evaluating non-chemical stressors in the context of a cumulative risk assessment under the Toxic Substance Control Act. Next slide, please. Next slide, please. Oh, there we go. Thanks. So this slide, I just want to talk briefly about the scope of our draft proposed approach for cumulative risk assessment of the high priority phthalates and the manufacturer requested phthalate under TSCA. First, it's important to acknowledge that this is just a proposed approach. It's not a risk evaluation. No risk estimates are presented in our documents. Instead, it just outlines a proposed approach for the cumulative risk assessment of the 5 high priority phthalates, which includes diethylhexyl phthalate, butylbenzyl phthalate, dibutyl phthalate, diacetyl phthalate, and dicyclohexyl phthalate, as well as the manufacturer requested phthalates, diisononyl phthalate and diacetyl phthalate, the cumulative risk to human health. Here, it's really important to recognize that a lot of work has already been done with phthalates and cumulative risk. Back in 2007, EPA asked the National Research Council of the National Academy of Sciences to evaluate whether or not it was appropriate to conduct a cumulative risk assessment of the phthalates. EPA further asked the NRC that if a cumulative risk assessment was appropriate, they asked NRC to provide recommendations for how the agency might go about conducting a cumulative risk assessment of the phthalates. NRC published their findings and recommendations to EPA in 2008 in a 2008 report, and ultimately NRC concluded that there was sufficient information available to support a cumulative risk assessment of the phthalates and even other anti-androgenic chemicals. Since NRC published the report, a number of other regulatory agencies have also conducted and completed cumulative risk assessments of the phthalates. This includes the United States Consumer Product Safety Commission, Health Canada, Australia NICMAS, European Food Safety Authority, and Danish EPA. And all of these agencies conducted cumulative risk assessments under varying regulatory paradigms, and they varied in scope and complexity. They all generally adhered to the recommendations outlined by NRC in the 2008 report. So really, EPA's proposed approach for cumulative risk assessment of the high priority phthalates and a manufacturer requested phthalate builds off of these previous cumulative risk assessment efforts and adheres to many of the recommendations provided in that 2008 NRC reports. One other point I'd just like to make on this slide is that EPA's proposed approach is not a reflection of completed systematic review, hazard identification, dose response assessment, or exposure assessment efforts. This work is all ongoing. It will be completed as part of individual chemical risk evaluations, each of which will undergo peer review. And these individual phthalate risk evaluations will, of course, provide important inputs into the cumulative risk assessment of the phthalates. But this is the last slide I have here to present. So I'll stop there and I can turn it back over to Ala or Danielle.
Well, thank you. Any questions for the presentation for Anthony? Again, please use your hand function if you can and state your name. Any questions? Again, the whole purpose here is so that you're clear on what the questions are, and so that when we get to the meeting next week, you're not going to say, wow, that's not the right question to ask. So please, please provide that info at this point if you can. Oh, got one. Dr. Chason.
Thank you for the presentation. This is Chris Chason.
Put your video
could you? Oh, just a moment. Sorry.
Thanks.
Yes. Could you please restate for me, is the approach intended for risk assessment, for cumulative risk assessment, does it include the chemical And I know it does not include the non-chemical stressors. Does it include the chemical stressors? I thought it did.
Hi, Chris. Yes, that's correct. It includes the chemical stressors. So
Okay.
it considers the 5 high priority phthalates and the 2 manufacturer requested
I thought.
phthalates.
Okay, thank you for that.
You're welcome.
Okay. Any other questions? Okay. Well, I think you you must have given an amazing presentation to get cleared everybody out. So at this point in time, if there are no further questions for this particular component, let's go ahead and I guess move on to our public commenters at this stage. We'll still keep it open, and Anthony, I'll allow questions after the public commenters if that's okay with you. So please stay put if that's okay. So at this point, we have several public commenters. The first on my list is Eileen Connolly, who's from American Chemical Council. Just a reminder, I believe you have 5 minutes for that presentation. So, and I don't hear any.
See Miss Conley on the line.
Ah, okay. So
I believe Dr. Schlenk, I believe public comments started at 1:40.
Okay,
so we may be a little bit early. I did invite them to join at 1:30 in my email to them. So don't know if we want to wait.
Well, maybe we'll do a survey to see who's actually here. Can you check to see who's actually here so that maybe we can move on? Maybe some, if you are here, can you raise your hand?
Can you not hear me?
Go ahead, Ms. Conley, we can hear you.
Oh, perfect.
Join at 1:30 in my email to them. So don't know if we want to wait.
Well, maybe we'll do a survey to see who's actually here. Can you check to see who's actually here so that maybe.
Ms. Conley, is your YouTube stream on?
I'm sorry.
Here.
This is Eileen Keneally. Can you hear me?
Yes. Go ahead, Ms. Conley, we can hear you.
Yeah.
Perfect.
Yeah, I'm sorry. We were told to join at 1:30, so.
Somebody's got an echo. Maybe we'll do a survey to see who's actually here. Can you check to see who's actually here so that maybe.
Ms. Conley, is your YouTube stream on?
Yes, let me see if I can figure out how to turn it off. I'm sorry.
Here.
This is Eileen. Okay. Is that better? Sorry.
Yes.
Yes.
I was struggling to launch the Zoom as you were talking because it said not to join till 1:30. Okay. Great. Thank you. I'm sorry. Does it, you don't need my video, I imagine.
No,
yeah, if you have your video feature on,
that'd be
please
great,
turn the camera on.
Because it is YouTube. It is going to be on YouTube. So
sorry, let me find it. Okay. I think that's it.
There we go.
Okay. Thank you. Good afternoon. Thank you. My name is Eileen Keneally. I'm from the American Chemistry Council, and I just have a few brief points that I want this panel to consider. ACC requests that the SACC recommend the EPA set clear criteria for decision-making. For example, hazard index greater than 1 at a 95th percentile. ACC would like the SACC to consider recommending EPA identify what represents a cumulative risk versus what represents a single substance risk. ACC would like the panel to consider what is the added value of spending additional time modeling exposures when NHANES represents the best available science. ACC would like the SACC to consider whether the identified mode of action and thus the PODs developed would be appropriate for populations outside of the male programming window, for example, infants, toddlers, and children. ACC would like the panel to consider the utility of relative potency factors, which will introduce additional uncertainty being developed for substances where data is available for the identified endpoint. ACC would like the panel to consider incorporating human relevance, whether by the addition of an uncertainty factor or some other means into the risk assessment. And then finally, we recommend the panel consider implications of metabolic saturation when considering implications of cumulative risk, particularly where there are large differences in potency and a lack of evidence that one of the substances can cause the adverse outcomes of concern. Thank you so much.
Thank you. Any questions at this point?
I would just like to make a general comment that the comments in for this preparatory meeting are dedicated to the scope and clarity of the charge questions, but all other comments can be deferred to the next meeting, to the meeting that is coming on May 8th. These oral comments may be made, these type of oral comments may be made on the May 8th meeting. But for today, we're focusing on the scope and clarity of the charge questions. Thank you.
Okay, any questions from the committee? Okay. Let's go ahead and move on to our next presenter if they're present. I think we're still ahead of schedule. So is David Dow on the line?
I don't see David, but we do have the next one, Jonathan Klatsmas-Katz.
Okay. Jonathan Kalmus-Katz, are you there?
I am. Can everyone hear me?
Perfect. Yep. Thanks.
Okay. Good afternoon. I'm John Kalmus-Katz, senior attorney with Earth Justice's Toxic Exposure and Health Program. I want to thank EPA for the opportunity to comment and the members of the SACC for your service on this critical review panel. We will be submitting comments on EPA's general principles for cumulative risk assessment and on EPA's proposed approach for a phthalate cumulative risk assessment this Friday. And we ask that EPA provide those comments to the SACC for their consideration. Today, I'd like to focus on the importance of the SACC's role and the scope of its charge. For decades, EPA risk assessments have attempted to determine whether someone who is exposed to a single chemical, often from a single source and exposure route without any added stressors, would experience unreasonable risk. If the members of the SACC can identify a single person who lives under those cloistered laboratory-like conditions and who would be adequately protected by EPA's current risk assessment approach, you're doing better than me. We know that people are routinely exposed to combinations of toxic chemicals, many of which cause additive or synergistic effects. We know those effects are worsened by non-chemical stressors like income insecurity, racial discrimination, and limited healthcare access. And we know that communities of color, Indigenous peoples, and other environmental justice communities often experience the greatest cumulative risks. The SACC's charge is to advise EPA on how it can best account for those real-world exposures and risks. Now, contrary to EPA's claim that it made in the slides just now, cumulative risk assessment is not a discretionary add-on to the TSCA risk evaluation process, which EPA can conduct when it has perfect data and omit when it feels that it's too difficult or burdensome. Instead, it is an essential and mandatory part of every TSCA risk evaluation and risk assessment. The 2016 TSCA amendments directed EPA to evaluate chemicals risks to potentially exposed or susceptible subpopulations, who, by virtue of increased chemical exposures or increased susceptibility, may experience greater risks than the general population. Just as sensitive life stages and genetic polymorphisms can render groups more susceptible to harm from chemical exposures, so can non-chemical stressors and cumulative exposures to chemicals that cause additive health effects. The evaluation of risk to potentially exposed or susceptible subpopulations thus requires the consideration of cumulative risk. TSCA also requires EPA to conduct risk evaluations in a manner consistent with the best available science. As the National Academy of Sciences, the American Public Health Association, and prior panels of this committee have made clear, the best available science for chemical risk assessment necessitates the consideration of cumulative risk. So to help EPA comply with those mandates and to conduct risk evaluations that cover all relevant exposures and risks, we urge the SACC to interpret its charge broadly. Your feedback should be guided by your view of the best available science and not by what EPA says it is currently planning to do or not do in these documents, because you can help shape that. Where EPA asks for key methodology documents that could inform EPA's approach to cumulative risk assessment, as it does in Charge Question 1, the SACC should recommend resources that address the areas missing from EPA's cumulative risk principles, such as the quantification of non-chemical stressors and cumulative ecological risks. Where EPA asks about additional areas it may consider for inclusion in the cumulative risk principles, that's Charge Question 4, the SACC should advise EPA on how to account for cumulative risks that cannot be precisely quantified, such as the use of additional uncertainty factors. And where EPA seeks data sources that EPA may consider for developing the cumulative fence line assessments, and that's Charge Question, sorry, I need to scroll down to my footnote 21, the SACC should look broadly at all the ways that fence line communities are exposed to toxic chemicals, as well as the stressors that increase susceptibility to harm from those exposures. Our substantive comments will address those issues in greater detail, and we urge the SACC to consider them. And with that, I thank you again for your time, and I'm happy to answer any questions.
Great, thank you. Any questions from the committee? Trying clarification of the comments. Okay, thank you. I just got a message saying that we have no other commenters online yet. So let me just do a roll call just to clarify, just to make sure. So David Dow, Dr. Rizvi, Lauro Silva, or Angela Chelaman. Anybody online? So I guess we have, what, 3 more minutes until the agenda had that. Shall we do a 5-minute break?
David Dow is online.
Oh, he is. Fantastic. David Dow?
Can you hear me?
Yes. Thank you.
I sent in some written comments. I'm David Dow. Dr. David Dow. I'm a retired Marine scientist and a resident of Cape Cod. I sent in some written comments. I'm just going to mention the 5 bullet points I mentioned. Number 1, like PCBs and PAHs, PFAS bioaccumulation and subsequent hazard assessments under TSCA should be done as a class with over 15,000 isomers with a variety of biological, chemical, and physical properties. Number 2, exposure pathways should include bioaccumulation and should include airborne, food, surface, water, and sediments, kettle hole ponds and coastal abatements, etc., to support EPA's exposure stress response conceptual modeling approach. Number 3, watershed-based adaptive ecosystem-based management approaches should be employed like those here in Cape Cod for our comprehensive wastewater management plans. And also this technique was used in EPA headquarters Walkway Bay Watershed Ecological Risk Assessment Project, in which I participated. Number 4, environmental justice concerns should be addressed by listening to stories of frontline citizens suffering the consequences of toxic chemical exposures. This is similar to the UN Water Justice Report developed by Katerina de Albuquerque. Hopefully some of these frontline communities will receive EPA grant funds. Number 5, more research and pilot projects should be addressed more research and pilot projects are required to remove PFAS chemicals from source areas. The Fire Training Area 1 plume, which runs underneath my home, includes source areas for water and sediments from Ashumet and Johns Ponds. And finally, the role of the microbial food web in the bioaccumulation of PFAS chemicals in the aquatic food chain needs to be explored as a consequence of climate change and nutrient enrichment, leading to its dominance over the traditional grazing food chain. Thank you for considering these comments.
Thank you, Dr. Dow. Any questions from the committee regarding Dr. Dow's comments? Dr. Chasen.
Did you say that these comments from the public will be available in writing for us? Is that possible?
Ala, is that, I believe.
Sure,
they will-
any written comments submitted to us will be available to the panel.
Actually submitted my comments in writing earlier this morning.
Okay, so to process it and publish and post it on the docket, it takes a few days, maybe 1 or 2 days. So once we receive it, we're going to send it over to everyone in the panel. I'd just like to remind the public commenters, so that the panel will only focus on the questions on whether or not the charge questions are clear. Any other comments can be presented during the May 8th meeting, and we will discuss it at that time. Thank you.
Okay. Any other questions before we move on? Okay, I have listed next Dr. Rizvi. Are you on? Doesn't seem. I
Don't see Dr. Rizvi on.
Yep. What about Silva? Laurel Silva?
No.
No. And or Chelaman?
Fortunately not.
Okay. Again, shall we maybe take a 5-minute break to make sure that they get on a little bit later? Is that appropriate? Ala, do you think
Yeah,
that would?
sure. That would be great. Yeah.
Okay, so let's do to get us back. What? Let me look at the agenda just to make sure if they
Can
were.
we post the agenda? Well,
yeah.
Slides.
The agenda was here. Yeah, so they have till 1:40. I don't know if maybe they were thinking they might be a little bit later than that, but shall we wait, come back at 1:50? Would that be okay? And if nobody
Okay.
shows up, we'll move forward to the next item. How's that sound?
Sounds good.
Okay, so let's we'll break till for 7 minutes, I guess, according to my.
Yeah.
And come back and see if anybody has joined at that point. Thanks.
Okay.
You hear me?
Yes,
Okay, sorry, my other meeting went over.
I was about to send you an email. I said, "Is this already Zoom link?"
Like, why am I scheduling these back-to-back meetings? I mean, this.
Kurt,
Yes.
we can hear you.
Okay, we're back on now. So I had a question from Dr. Hertzberg in the chat box. Richard, do you want to go ahead and bring that up? If you're there.
Sure. It was just that when a commenter suggests that EPA can.
Need your video if you can.
Okay, it's coming.
Yeah.
Is that better?
Yeah, thanks.
Okay. Just that when you have a suggestion that EPA consider other methodologies or other approaches, it'd be really useful if you could give the citation and maybe provide more details on exactly where these approaches are existing, especially if they are in other regulatory agencies. Thank you.
Okay, thanks. All right, Kurt, do we have our other commenters on? Hopefully.
I don't see any others.
No. Okay. Well, it sounds like they will probably be providing written comments, as it seems that we've had, you know, sort of the oral comments seem to be from a written format. So I would assume that we would get those for the May 8th meeting at some point. So with that, I guess the next item on the agenda would be a discussion. Does anybody have any points that they would like to discuss at this point?
So as far as the agenda goes, I think here we will be presenting the charge questions one by one, posting it on the screen, and then we will call for it by its charge question number. If anyone has a question, we're going to give like a few seconds. If no questions, we can go to the next question and so on.
Okay.
So Will, can you put in the first charge question? Put it on. So anyone has a question, they can raise their hand and then they can ask the question. If it's clear, we move to the next.
Dr. Hertzberg?
Yes, this is consistent with one of the commenters from the public as well. The methodology that's presented in the proposed approach for cumulative risk assessment focuses mostly on dose addition. There are other approaches out there, especially coming out in the last 5 to 10 years, that are addressing pieces of cumulative risk assessment, but not the whole process from data to regulatory action. And these, for example, are methods including silicon-based modeling of pharmacokinetics, in vitro pharmacokinetics estimates, in vitro relative potency factor estimates, and some others using NAMs, the new approach methodologies. Are these part of the scope that you would like to have in these additional key methodology documents?
So with that, we go to Andrew. Or Anthony, I'm sorry.
Anthony.
Yeah, Anthony, sorry. Anthony, do you like to address that question?
Yeah, sure. Thanks, Rick, for that question. Yeah, so as you pointed out, our methodologies and the proposed approach really focus on use of dose addition, although we also gave some consideration to response addition and integrated addition. I think I would say, you know, if with your expertise in this area, if you think some of those other approaches would be helpful for us to consider, then I think that would be, you know, within scope of this question. Although here, you know, charge question 1 is specifically, I'd like to point out, dealing with the proposed principles document, not necessarily the more detailed phthalates approach. So those documents that you mentioned, Rick, might be more useful for the phthalate proposed approach.
And everyone hear Anthony speak? I kind of hear him a little bit faint. I'm not sure if everyone hears him clearly.
I'm hearing him fine.
Okay.
I heard him fine.
Okay, then maybe I just need to raise my volume.
Okay. All right. Dr. Chason?
Thank you, Chris Chason. I'm just going to make a sort of editorial comment. EPA's made it clear, I think, that this document is proposed principles and not a statement of required methodology. Yet this language about methodology versus principles, maybe it would be good if you re-reviewed your very specifically the language that you're being used for, because right out of the gates, charge question number 1 asks for a methodology paper. There are a lot of documents or writings or things that speak to principles for a lot of the elements within CRA, but are not methodology documents. So did you intend to limit your requests for specific methodologies, or are you speaking to principles? And quite frankly, why are you asking for methodology documents under a principles document when you just got done saying this was not a methodology paper? So I'm just recommending that you clarify this specific question or change your presentation or somehow, you know, I think it's confusing.
Anthony, do you want to respond?
Yeah, sure. Thanks, Chris. That's a good point. I think we can take that back to the team and we can talk about whether or not we can clarify that. Thank you.
Okay.
Dr. Hertzberg, your hand's still up. Are you, do you have another question or? Oh, okay, thanks.
I was just going to clarify that mine was not so specific to the phthalates. It was on just general methodology. And like Chris was saying, there are principles that are being published now that directly lead to methodology. Some that have been sort of validation checked using lowest adverse effect level, for example, estimated totally from in silico modeling. So they're relevant, but they're not at all just specific to the phthalates.
Okay. Anthony, you want to respond, or shall we move on to question 2?
I think we can move on. We can take take that input back to the team and clarify the question.
Quick
Okay,
question
great.
number 2.
Any questions of clarification? Or recommendations, I guess, as well, which it sounds like we're taking as well. So, Dr. Hertzberg?
Yeah, it's me again. As a user and developer of weight of evidence approaches for mixtures and interactions in particular, are these intended to have some way to either quantify the weight of evidence or at least put it into categories that say this is minimally acceptable, this is perfect, this is somewhere in between, or this is not at all useful? Is it going to go to that far for these kinds of principles?
Anthony?
At this stage, no, it does not go that far. We talk more about the weight of evidence, and it increases or decreases our confidence in the grouping based on the various line of evidence or the area of uncertainty.
Okay. Are we good? Okay. Dr. Jason?
Follow up on that. Wait, am I muted? No, okay. You provide, by the way, I think for a principles document, it's good to keep the principles clear and concise without, writing a whole book on it. But you have provided quite a bit of something that gets into the, let's say, the details of the traditional thought, at least on the toxicology side, but there's nothing equivalent to that at all about exposure or identification of special populations. And I was wondering, was that intended, or are you open to the idea of having a little more depth provided to help out with filling out those two of the three, I think, key areas?
Anthony, go ahead.
I might turn it over to my colleague, Micah Escher, who's the exposure assessor, and see if she's got an opinion on this one.
Hi, this is Micah Arshura. We did keep it a little sort of, as you say, Chris, more broad. And because in our proposed approach for the phthalates, we did dive into further sort of populations for co-exposure and the principles, we did sort of take it more broadly, right. Did not look sort of for specific populations. If there are input, that will help us develop more the principles level that might be cross-chemical cutting, we do welcome that input.
Okay.
Question. Thank you.
Just as an extension on that, I think it's very likely in the future that people for doing other non-phthalate CRAs would look to your principles document, but they might not think to go into your phthalates conversation for setting it up. So it might be worthwhile to continue that. Now, I think we're bridging here into the commentary on the content, so I'm going to stop it there and pick this conversation up when we're actually doing the review of the document. But I just was wondering, in this case, whether you had premeditated, if you will, to keep it without detail in the principles. But thank you for the comments, Micah.
That was Dr. Chasen. Any other questions on number 2?
Hi, it's Anna Lowett, Senior Science Advisor, OPPT. Just a clarification on the scope. Remember that identification of the potentially susceptible populations is not unique to cumulative. And the toxics program is developing a framework for that applies to not only cumulative, but single chemicals. So also just thinking about the scope of what we're doing and how we're doing it, that where things lie within the cumulative space that are unique to that, and things that it would apply to across to single chemicals, but also the cumulatives.
Thanks, Dr. Lowett. Any questions regarding charge question 2 anymore? Okay, Holly, you want to go 3? Any comments or questions on 3? Yep, Dr. Hertzberg, figured you would be back on this one.
Do you want approaches added to this or at least publications cited that are variations of additivity? And this can go from some of these that are coming up now on quantitative AOP approaches, as well as those that are talking about key events in AOPs where if you have a certain condition, then dose addition would not apply because you're essentially sub-threshold on all the contributing key events. So there's no further propagation down the AOP to add. And do you want anything on specifically interactions? I'm thinking, for example, the ATSDR interaction profiles, as well as EPA's approach on interactions.
Anthony?
Yeah, thanks, Dr. Hertzberg. Yeah, as a default approach, we are proposing the use of dose addition, but, as the best available science supports, we consider other approaches. So I think those documents you referenced would be useful for us to consider.
Okay, anyone else on 3? Okay, let's move forward to 4. I think that's pretty straightforward. Anybody have any comments on that one? Okay, let's go on to 5. At this point, I guess we're moving into the phthalates component, so seems pretty straightforward. Anybody? Dr. Kwok?
Yeah, I have a question. This question appears to focus on the information come from the regulatory agency and authoritative bodies. Is that the only focus? Can you clarify a little bit? So meaning the information come from the other regulatory agency and the authoritative bodies only.
Yeah, thanks, Dr. Kwok. Yeah, I can definitely clarify. So for the purposes of our proposed approach, we really focused on the cumulative risk assessments conducted by these other regulatory agencies, because these cumulative risk assessments have, tended to go through, public comment, in some cases, peer review. So they've just gone through more peer review and public comment than that, say, something that's just out there in the peer reviewed literature. But, we are aware there are, a dozen or even more than a dozen examples of phthalate cumulative risk assessments that have been published in the peer reviewed literature. So we are aware of those, but the focus here really was on these cumulative risk assessments conducted by other regulatory agencies, just because they're, at a higher level of peer review.
Okay, thank you.
Any other questions or clarification? Okay, shall we move on to 6? Any questions here? Seems to be a bit of overlap with the first document in terms of key concepts, but. Okay, hearing none, shall we move on to 7? Any comments or questions for number 7? Okay, number 8. Anyone for number 8? Okay, moving along. Number 9. Any questions on 9? All right, on to 10. Seems pretty straightforward. Any questions there? Okay, 11. No questions? Okay, 12. This may be the methodology specifics, I guess, here, perhaps. Any questions? Okay, 13. Any questions there? Okay, 14. Any questions? Moving on to 15 then. Okay, hearing none. 16. Oh, this is a long one. Okay. Any questions on 16? Great. All right, 17. Any comments here? Okay, 18. Hearing no comments. On to 19. Any questions or comments there? I know COUs has always been an issue in the past, so. Okay, 20. Any questions here? And 21. Okay, any questions or comments for 21? Oh. Dr. Howeldsland?
How to tell. Just for my own education, could you please clarify what a fence line fence line assessment is? That's not something I'm familiar with.
We actually had a panel dedicated to that. So Anthony, do you want to take a crack at that?
I might actually turn this one over to Mike, our exposure assessor, as well.
Okay.
Yes, it is defined in our document in section 6.3.2. So I will say that we relied a lot on, as Dr. Schlenk said, the fence line SACC that had occurred. And so the definition is pulled from that sort of SACC meeting and SACC presentation. So you'll see it sort of defined within our document. So I don't want to provide sort of misworded definitions at this time. So we do provide the definition within the document. And so the fence line is sort of is explained there. And so if that's okay with you.
I'm sure you have a link actually to that entire docket. I would imagine with that was quite a long one. So I'm sure there's a lot of info for that.
Yes, and I will say that it is sort of an ongoing development of not only defining, but developing the methodology here. So in this charge question, we do state that it is sort of something that we had not fully developed, but we have defined it for the context of our current proposed approach. And so this is welcoming input on sort of developing methodology and, you know, moving it forward as well. So I will state that as well. Thank you.
Thanks. Okay, any other questions or comments on the charge questions? Okay. Ala, do you have anything else we need to discuss before we go forward?
I was muted, sorry. So it seems that looks like we covered all the agenda items, and also looks like the OPP team did a great job in formulating these questions. So everything seems to be clear, maybe except there were a few questions in the first four questions. But in general, I'd like to thank everyone who attended this meeting. I would like to thank Anthony and Michael for their presentation and the OPP team, and all SACC members, ad hoc reviewers, and the public commenters who made comments today. We will then, unless there are other questions, we can adjourn this meeting, and then we will see you all again on May 8th.
Thanks.
Any
everyone.
other questions? All right, and then we'll see you on May 8th.
In a couple of weeks.
Thank you.
You're welcome.
Thanks, everyone.
Thanks.
Thank you.
Thank you.